Okay, and we're back. We're talking about the basics of the brain, blood supply to the brain, and the cranial nerves. So let's continue from where we finished last time. We finished at number 20, and now we're looking at number 21 on my blog. Okay, so next is the trigeminal nerve. What is the foramen and its function? So it comes out of the superior orbital fissure, and it is a mixed sensory nerve, and you can say that it covers the ophthalmic branch, the maxillary branch, and the mandibular branch. So the ophthalmic is known as V1, which is sensory, and the maxillary is V2, that's sensory and autonomic, and V3 is the mandibular, and it's motor, sensory, proprioceptive, and parasympathetic. Okay, so let's move on to number 22. So this is the abducens nerve. So the abducens nerve it comes out of the superior orbital fissure, and it is motor, and if you remember the lateral rectus muscle, LR6, which is that part of that pair with SO4. This is moving the eye to the side. 23, facial nerve. It is comes out of the internal auditory, and it is mixed motor. So for the face and muscles from the second brachial arch. Lacrimal, this is the nasal gland, sensory. Taste for the anterior 2/3 of the tongue. Number 24, vestibular cochlear nerve. So the foramen is the internal auditory. It's a special sense nerve, auditory, cochlear, balance, vestibular, and this is superior and inferior divisions. And number 25, glossopharyngeal nerve. This comes out of the jugular foramen. It is a mixed sensory, so for the carotid, the body, and the sinus. Taste, bitter, and then there's pain. Middle ear, motor, stylopharyngeus, and don't forget the parotid gland. Number 25, the vagus nerve. That's the 10th nerve. And this also comes from the jugular foramen. It is mixed sensory. Aortic arch, body, taste. This is for the epiglottis, and motor vocalis, swallowing, bronchoconstriction, peristalsis, bradycardia, and vomiting. Next, number 26, the spinal accessory. That is comes out of the jugular foramen, and it is motor, and it innervates the trapezius and the sternocleidomastoid. What's not included here is the 12th spinal nerve, which is the hypoglossal. And so we'll move on to the number 27. So when we think about the spinal nerves 3, 4, and 5, the first part, and 6, what foramen is this? Number 3, 4, the first part of 5, and 6. That is the superior orbital fissure. Number 28, the spinal nerves 7 and 8. What foramen do these come out of? They come out of the internal auditory. Number 29, spinal nerves 9, 10, and 11. What foramen? The jugular foramen. Number 30, spinal nerve 12. What foramen? The hypoglossal canal. Okay, number 31. Small protrusions of the arachnoid, which is the thin second layer covering the brain, through the dura mater, the thick outer layer. They protrude into the venous sinuses of the brain, I'm reading a definition here, and allow cerebral spinal fluid to exit the subarachnoid space and enter the bloodstream. What are these collectors of CSF you can find in the brain? These are the arachnoid granulations. Number 32. What are the layers of the scalp? And so the acronym is Scalp. So S is for skin, C is for connective tissue or galea, A is for aponeurotic, L is loose areolar connective tissue, and P is pericranium. 33. Name the 3 areas where hematomas occur in the brain. First, epidural space, next, subdural space, and next, subarachnoid space. So we're going to discuss the details of the epidural space, subdural space, and subarachnoid space hematomas later. Number 34. Describe some details about the subarachnoid space. So this is the space between the arachnoid and pia mater, which contains CSF from the ventricular system, and it also cushions the brain. What are the subarachnoid cisterns? They occur mainly at the base of the brain, and they collect large pools of CSF. Arachnoid granulations drain this CSF when it is not properly drained. And then I've written down some more details about what subarachnoid cisterns are. And it says they are areas within the subarachnoid space where the pia mater and arachnoid membrane are not in close approximation. The subarachnoid tissue is not as abundant here as in the normal subarachnoid space, and CSF gathers to form pools or cisterns, which is Latin for box. Number 36. Intracranial hemorrhages. So when you talk about the extradural or epidural hematoma, what artery is injured, or what is injured? This is the middle meningeal artery. So the middle meningeal artery is for the epidural hematoma. Next. What is injured for a dural border hematoma? That is the cerebral vein. So the cerebral vein is injured for the dural border hematoma. Next, what is injured for a subarachnoid hemorrhage? This is the cerebral artery. Okay, to review. For the epidural hematoma, it is the middle meningeal artery. For the dural border hematoma, it is the cerebral vein that is injured. And for the subarachnoid hemorrhage, it is the cerebral artery. Okay, alright, we'll go one more minute. 39. What is the largest dural venous sinus in the sagittal groove? The superior sagittal sinus, which is also known as the superior longitudinal sinus. This is the sinus where other veins can drain into. And a little bit of detail. One of the 6 venous channels in the posterior of the dura mater that drains blood from the brain into the internal jugular vein. It has no valves. The superior sagittal sinus receives the superior cerebral veins, which are veins from the diploi near the posterior extremity of the sagittal suture, the anastomizing emissary veins from the pericranium, and the veins from the dura mater. It also anastomoses with veins of the nose, the scalp, and the diploid. And it says, note, you would also find an arachnoid granulation in this area. So now we know what the superior sagittal sinus is. Thank you very much.